I see both sides of the argument, and I see where the Premier is coming from in terms of concern around stigma. And with that in mind, I think it's very important to remember a couple of things. One is that what these maps show is that we have COVID everywhere in the city of Toronto right now. So if you think you're in a safe neighborhood where there's no COVID and it's someone else's problem, you are wrong. Wherever in the city you live, you're wrong. It's everywhere. A second thing to remember about these maps is these are the home addresses of cases. This is not where people acquired COVID. This is where people who have become COVID cases live. And what we know from our conversations with Toronto Public Health and Peel Public Health is a lot of this transmission relates to workplace transmission for example, in long-term care facilities, in industrial workplaces that haven't closed down because they're essential, food processing plants, things like that. And then people acquire infection in their workplace and then bring it home and infect household members. As you mentioned, a lot of the hotspots, as you've referred to them, are lower income neighborhoods that have a lot of multi-generational households. So that means if you have a 30-year-old or a 40-year-old working outside the home, bringing this back into a crowded apartment with a couple of generations of family living together, you have older relatives there who are the people we are seeing in hospital showing up very sick and getting into the ICU. That's exactly the story that folks have been seeing at Michael Garron Hospital. I know for the last number of weeks, that sort of setup. A younger person works outside. Yeah. I'm
sorry, I don't mean to cut you off, but if that, and we certainly heard that similar caveat from Dr. Dalla, who's the city's public health officer. These are residential indications. This is not, as you said, where people have contracted this, but at the same time, by knowing where people are who are dealing with COVID-19, does that not enable them to sort of flood those zones with more testing, more awareness programs to prevent further spread?
Yeah, I think that's exactly right, and I think they were doing that beforehand. It's just the question is does publicizing it facilitate that effort? And I think you're right. I think it may. So what we need more awareness. We probably need some testing blitzes in places where there's a lot of COVID, but we also need to focus on support. This isn't failure to isolate or failure to comply with the province's guidelines like we saw in Trinity Bellwoods last week. This is people living in situations where they can't isolate. They're in crowded apartments. There are a lot of folks who are lower income. You get into issues around food security in some of these communities. If you ask someone to stay home for 14 days and they've got a couple of small kids, well, you got to support them through that process. And if they're a single parent, for example, that's going to be awfully difficult. So this is about support and not sanction. We need to help these parts of Toronto to move forward. It's holding us back as a city, and the city is holding back the entire province.
That's an important distinction. That's 75% of cases in Ontario from the Toronto area. That emerged as well. So if all of that, the release of this data and portrayal is to prevent further community spread, you've just released a paper that is also very interesting in that regard, taking a look at the effectiveness of physical distancing strategies and the effect of physical distancing on the risk of a COVID-19 resurgence. In simple terms, what did you find?
Well, what we found is we did some modeling way back in February that said, if the province doesn't lock down, we're going to go the route that Italy was going at the time we wrote the paper and that New York went in March and April, and that we did not go, that we needed a lockdown to avoid our ICUs overflowing. When we wrote that paper, we didn't actually have data to it's called calibrating, when you make your model look like reality. Because our epidemic hadn't happened yet. And so we were able to use data from the province and estimate that we reduced contact numbers in Toronto with lockdown by about 70%. That was enough to stop our epidemic pretty much in its tracks in terms of the exponential growth phase, the extremely rapid upward growth phase that would have overflowed our ICUs and killed thousands of people. So that didn't happen. And again, kudos to the Premier because he made that hard call. Unfortunately, we're still vulnerable to COVID. It's kind of grumbling along right now with a reproduction number of about 1. That means each old case makes 1 new case. So we don't have an exploding epidemic, but it's also not going away. We will be vulnerable to resurgence in the future just because so many of us are still susceptible to COVID. We know even in the hardest hit places, about 90% of the population is still susceptible.
So you have shown the effectiveness of the strict strategy, that lockdown, as you said, and how it kept people out of hospital. Then what might it indicate for that second wave you're referencing? Because there seems to be a reluctance on the part of authorities to want to impose strict measures again, and a reluctance on Canadians to want to live under such strict measures again. But it looks like those strict measures may be helpful in terms of preventing further spread and hospitalization. So what do we do then when a second wave does hit?
Well, that's why we have to get so much stronger at our surveillance game. That's why we have to start playing, a friend of mine calls it whack-a-mole, snuffing out the clusters as we find them. We have to be able to see those clusters. That's why I've had such an emphasis on testing for the last number of weeks. And we need to get those turnaround times, the time from someone getting symptomatic until they're tested, identified by public health and so forth, get those as short as possible, so we can keep a lid on this. We probably are going to have more lockdowns in our future over the coming months. And again, this is something we said in our paper from February, March, is that the most likely future for us is going to be a series of lockdowns and relaxations and lockdowns and relaxations until this either ends via natural sort of enough people have gotten infected for it to sort of subside, or more likely when we get a vaccine. So that unfortunately probably is going to be our reality, especially come the fall.